as per the schedule. Okay, good afternoon, everyone. All the doctors, all the students of homeopathy, and all those who love to hear about homeopathy and what homeopathy can do for kids during this COVID pandemic, or even otherwise in any kind of fever cases, viral fevers, URTIs, and more. So, we are here to learn today, and I would try to share my screen now. We will start with some cases, some recent cases that we have seen today. Um, as such, I have a good log of at least 50-60 cases in the past few months, but uh, I would like to show just a few of them. I'm having a little trouble with the settings of this Facebook Live. So, before we start, I would like to tell you one thing. Most of the new doctors are very scared or sometimes confused about taking a pediatric case, especially if the fever is high. The parents are very restless. People are very scared. But let me tell you this, with the right medicine and if you are confident with your prescription, then kids are the first one to respond and they respond really well. They respond very quickly to homeopathic medicines, and sometimes the most of the times the results are so promising, so amazing, and it's very motivating for everyone because it's nothing better than watching kids improve so quickly. जल्दी से आपको रिजल्ट मिलता है and पेरेंट्स तो आपके भक्त बन जाते हैं, I should say. So it is very promising, and I suggest if you're new even and you're not taking pediatric cases, then start taking them. It's just that you have to have a mastery over the art of acute prescribing, है ना? जो आज हम सीखने वाले हैं. Okay. So screen sharing is giving me a little trouble. Um, Screen sharing हो नहीं पा रहा है, and without that we won't be able to. One more thing I would like to tell you all is कि don't be scared of seeing patients. Abhi already it's been 2 years since we are seeing unknowingly we were seeing COVID cases since around December 2019. You know, even before we knew the name of this disease, we did not knew about it, but we were watching the cases, we were taking the cases anyway. So I would like to tell you that आप घबराइए मत, you take the cases. If you are scared of examination, then video calling पे लीजिए, but you take the cases. Don't be afraid of it. If you are alive since 2 years now in this pandemic, then I don't think it can do much now. Okay? So that is one thing I would like to say before we start. And screen sharing is still giving me trouble. So what I'll do is, if it is not possible to share the screen, I will read out the cases. I think that should work. I think that, and I need to see the comments because there will be some questions. Um, okay. I don't think screen sharing is feasible. I will read out the cases to you. So the first case that I want to talk about is a case of 12-year-old boy who is very allergic, And last year during the pandemic, he visited with post-COVID infection, post-COVID bacterial infection. He had a suppurative tonsillitis last year. He was about to be admitted, but the parents were very scared of admitting because of the peak of pandemic. It was in the month of May or June sometime. So we had saved this boy with pyrogen. We gave him pyrogen for the fever, and then the infection cleared quickly. This time, this boy visited with the following complaints. So he was playing in sand and he's allergic. So he immediately started sneezing and itching in the throat. He could not sleep that night. He was wheezing already. This happened somewhere in late evening. So I got a call at late night around 11 a.m. and I asked him to come to the clinic quickly. So last time we had given him pyrogen and Merxol. So again this time I gave him Merxol 1 m. And for the fever, I gave him Ferromphos 200x on a SOS basis, and Blata tincture was given. And but in next 24 hours, he did not improve that much, and his breathing was difficult. And I was sent a video. Unfortunately, I cannot show you the video as of now, but a video was sent which showed that he was not able to sleep all night and he was very having trouble breathing as well. Coughing was frequent, nausea, retching, everything was very severe, and main indication of my remedy was nausea. I was having a lot of nausea with retching during coughing, and this time instead of the Merxol, I gave him Nux Vomica 200, and bladder was continued as usual. And in the next, by evening, after 3 doses, we gave him medicine in the morning. By evening, he was much better. At night, he slept well. Next morning, we got an update and we continued it for 4 days. After that, we stopped the medicine. So, this is what we did. Unfortunately, I'm not able to show you the whole thing. And anyway, um, so why we gave Nux Vomica has been one of my champion remedies during this pandemic, and we, as I'm sure you might have read the symptoms of this Omicron, and how the presentation is there in the kids. I'm sure we all have read that. Then nausea has been a very prominent symptom in recent cases. I have noticed that, and cough with retching, vomiting, nausea. So we have to consider that in the totality in those cases which present with, and if it is prominent. So in this case, Nux vomica worked beautifully, and in the next 24 hours, we got a very amazing result. So Nux is one of my champion remedies this time. Then, uh, one thing that we have noticed in this particular wave, that loss of smell and loss of taste is not very prominent, especially with the Omicron cases. This is what I noticed because there was hardly any patient who reported loss of smell and taste. Some adult patient did mention that they could not smell or taste, but there were just very few cases. So the virus has mutated and the symptoms are changing now. That's why we did not get these symptoms. But fever with chills is a very consistent symptom in this case. One more thing which I have noticed this time is the weakness and debility and fatigue is quite less. Most of the patients are recovering in few days, just like they recover from flu, and the fatigue is much less. In the earlier variant, during the month of April to probably, the weakness and fatigue remain for a really long time, sometimes even several months. And the hair fall was very prominent even that time. Okay, coming to the next case. So, second case is of a 4-year-old boy who was brought in by his father for fever. This was a COVID case because the parents were treated for fever and cold and all those symptoms just a couple of days back, and then the boy got the symptoms as well. So on 3rd of January, fever came. His whole body was very hot to touch, especially the head was very hot, and there were few bouts of dry coughing was there, and they had given some fever syrup, Febex syrup at night, and then they brought him in the morning. There was slight nose block. The child was dull at that time, and appetite was less. He was thirstless, and the main PQRS symptom was he was loquacious during fever. During fever, he was constantly talking. He was talking a lot, and upper body and head was very hot. So I'm sure we are able to guess the remedy, which remedy was given. So sudden fever, head very hot, loquacity during fever, and loss of appetite, refusing to eat. This is a very prominent symptom of and belladonna is first one, another one of my champion remedies during this pandemic. 3 doses were given, and along with that, in a gap of 1 hour, we gave 3 doses for the fever, and bio combination number 6 was given for the cold and symptoms, and they took it for around 2 days, and then he was fine. So medicine. The patient did not get fever after that. He was well with belladonna itself. Okay. So if you have any queries about the cases, you can leave them in the comments. I will answer the queries in a while. And I'll go to the third case now. This is a 5.5-year-old boy, and his mother had fever just few days back. Grandmother had mild fever a week back, and this is most likely Omicron case because everyone in the family got it, and they did not get it tested because they were fine by then. Even his elder brother got fever soon after this guy. So what was the symptom? Leg pain in the morning when he got up, and the child was unusually clingy and cranky, and he wanted attention. He was telling everyone, "मुझे ये हो रहा है, मुझे pain हो रहा है, पैर दबा दो," and all sorts of attention-seeking behavior he was doing. Obviously, he was sick. That's why. But this was very prominent symptom, like pain before fever. Thirst was low, and he was having cold since about a week. And fever came suddenly. It was accompanied with chills, and there was desire to cover, which is again a common symptom. But based on the clinginess, desire for attention, and telling everyone that I am sick, that need for sympathy and low thirst, and leg pain before fever. Leg pain before fever is given in repertory, and several remedies are there, but I gave him pulsatilla. Pulsatilla 10 was given because only that potency was available at the moment at their home. So pulsatilla 10 just 4 pills in water. I told them to sip the medicine water dose I gave because it was a higher. And then after an hour or so, the patient was fine, and by 2 p.m., 2 in the noon after lunch, he was running around. And then we did not feel the need to give him any other medicine. So he was fine. Uh, so clearly the indications of pulsatilla were thirstless and leg pain with fever and the mental symptoms, clingy behavior, desire for attention, sympathy. He was telling everyone that I have pain, I have pain. And again, okay, this is not there in my PPT, but the elder brother of the same boy got fever 2 days back. I think it was on Saturday evening. So the pain appeared suddenly, and he was having little more salivation, and there was a lot of redness in the throat. So immediately we started with Merck Sol 1M, which is another of my favorite remedies for the viral fevers and sore throats, if the symptoms match, of course. So Merck Sol helped with the pain next morning. Around noontime, he got fever only once. Fever was little high. The child was resting. We continued with the same medicine. We did not change anything. And he had a lot of sweating after that. And after a couple of hours, he was much better. There was a little dullness, but by Monday morning, he was able to attend his school also. Of course, online school, but that helped. So this was a case of Merck Sol, which I narrated just now. So one pointer I would like to give is whenever we are treating a fever case, especially a child, I would tell you to always be in touch with the parents because parents are already anxious and sometimes there are grandparents around. There is a lot of chaos that time. The child is crying and cranky, mother is restless, grandparents are restless. So sometimes if they are alone, then they are very scared how to deal with this. They don't know how to deal with a cranky child and fever sometimes. And the pandemic has made everyone very scared overall. And they are scared about themselves also कि अभी हमें हो जाएगा. All those things are there. So be in touch with the patient's parents, reply to their queries patiently. Sometimes they may ask very silly questions, but still reply to them and just remind them to use their common sense, be logical, and they have to be reminded to unconditionally love the child even if the child is very cranky. Because when children are cranky, then mothers might become very restless and cranky, and then the parents will use such language. So you have to remind them that the child is sick. The child is not doing it is not the fault of anyone that the child is sick or anyone is sick for that matter. So they have to be reminded that the child is sick. It's okay to be cranky and don't force feed that time because children are often fed by their parents. Even if they are sick, they don't understand that अभी खाने का मन नहीं है, taste alter हो गया है, भूख नहीं है, but they keep on feeding the child. कुछ खाया नहीं है, कुछ खाया नहीं, especially some mothers will do that. But I always tell them if your body is sick, then the body needs to conserve the energy and not waste the energy in digesting. So give them fluids, more fluids, ORS पिलाया, पानी ज़्यादा, नारियल पानी, whatever is suitable, या सूप बना के दिया, या पतली सी खिचड़ी, या दाल का सूप, something which is very traditional, which is warm, which is soothing, or maybe दूध रोटी, something as simple as दूध रोटी. So such things, if you give to the child, they are comfortable. They don't have to make an effort to chew or swallow, and you can feed them in the bed itself. And don't force them to eat if they are sick. This is what I tell all my patients that they should not be forced. They will eat tomorrow. Once they are better, they'll start eating. They'll start asking for food. So if you are forcing the child to eat, then they will probably puke, and then you have to clean the puke. And then it is such a waste and it's such a stress as well. So and then other tips like sponging. If the fever is there, then sponging with little warm water or tap water, depending on the temperature of water, but not with cold water. Sponging should never be done with cold water. So that helps. And if the child is resisting to be sponged, then you talk to the child and sponge only certain areas, like maybe only forehead or neck area, but don't force it. And then you have to be by their side, just tell them a story, massage their feet, just make them comfortable. And usually once the fever is over, they are active and playful again, and then you don't have to do all this. So for maybe 1 or 2 hours when they need you, just be there. So always tell to your patient that be nice to the child. It is not their fault that they are sick. They might have eaten some ice cream, they might have had some cold drink maybe, but then it is the virus that decides whom to infect. है ना? So you might get it even if you don't even eat an ice cream or a chocolate. So just sensitize them about being patient and being in touch. and answering their queries is very important in pediatric cases, because if you don't reply to their queries and they are very anxious, they may not trust you. And when it comes to kids, then trust is very important. And believe me, if you cure their child quickly, then the whole family is your patient, the whole family is your fan. So this is very good for building your practice at being responsive to some extent. That does not mean crossing boundaries, but yes, being responsive is good for your practice, especially if you have a private practice. You need to be there for your patients. Okay, coming to the next case. So this is the fifth case. This is a 3-year-old female. She was brought by father, and she has a history of travel, and father had a cold and fever after traveling, and mother is pregnant, so she did not come, but she was sneezing and all. She's also our patient. So anyway, so this 3-year-old girl, she had runny nose, sneezing. She was coughing at night. Cough was worse on lying. The mucus nasal discharge was yellow. Fever was there 4 days ago, but not at the moment. And nose block was there, especially when she was sleeping. And she was preferring warm drinks. She was rubbing her nose. Throat was right tonsil was little red. Chest was clear. Okay, and then there was some coughing with gagging only while sleep. So I'm sure those who are in the study group, they will be able to guess the remedy. Pulsatilla 200 was given, and also one dose of Drosera 200 was given to this child. I'll tell you why. Because this patient is our old patient, and she always gets this night coughs, and she's a typical tubercular child. Both parents are tubercular diathesis. So, Drosera is a good tubercular remedy, and they have this typical night wala cough that triggers as soon as you lie on the bed. The moment your head touches the pillow, they'll start coughing. So this time there was phlegm also and yellow mucus also. But since she needs Drosera very often, I decided to give one dose of Drosera, and rest of the Pulsatilla was given for 3 to 5 days, we told them. But the next day she was fine, and she even wrote a Google review next day that medicines work so quickly, something like that. So this was a very amazing case. So we could provide relief and good results in less than 24 hours. And the child slept well, and that's it. This is a very short case. Okay. So, sometimes what happens is some kids will respond quickly, but there will be a uh, some prolonged mild symptoms that will persist for some time. In that case, you will have to consider a different potency. For example, if you have given a 30 potency, you need 200 maybe, or you might need a different remedy. Sometimes maybe you are giving a partially similar remedy. Sometimes you may need a proper constitutional prescription. I'll be showing one particular case. Okay, the next case itself. I'll tell you. Okay. I'll be telling you another case, which is actually a case of asthma, not COVID. So this boy, mm, his parents are our patients from long time. He was brought in for the first time, and they told us that already history is taken. So I did. I was checking the files. I could not find his file, and I realized they have not given a history before. This was a new thing for me, and I had a very crowded OPD that time. So we quickly took some history on, and based on that, I gave him causticum as per the cough modality. But causticum did not help him. And then I asked the father a little more, and then he said that he's prone to bronchitis. Obviously, I did not have the detailed history, so with the incomplete information, I could not help him that much. So I was at the other clinic. I told them to pick up the medicine from clinic. They picked up Blata 30. Blata 30 was given, and he was better in next 48 hours. It took 48 hours to give relief, because normally my standard is 24 hours mein aaram hona chahiye, but this guy took 48 hours to get relief, obviously because it was not COVID or fever or something, it was bronchitis. So then I told them that I need to take a detailed case, and then after very lean child, quite an active animal lover, very timid. He had those eyes startling easily, and even the eyelashes and all that. So it was a typical phosphorus case. I started him with that. And so my point of telling you this thing is sometimes the chronic remedy, the constitutional remedy might be useful in the acute situation as well. So that if we know that he's a phosphorus, we might start the case with a phosphorus if it is an allergic complaint. But in many cases, especially when there is fever, you might need a different remedy, which may be in relationship to your main remedy. For example, I have few sulfur patients. So whenever they come up with fever, I just give them a dose of belladonna. Even they know that they have to take belladonna, they will not even ask me. Sometimes they'll just take it. And then there are some calcaria kids. So they might need in the acute phase, they might need Hepasulf sometimes. Even Merck is required. It is in relationship with calcaria. There is a remedy relationship chart I will try to share with you all. So if you know these remedy relationship, you can pick up your acute remedy very quickly and very efficiently. For example, lycopodium. Now, pulsatilla is acute to lycopodium. So many times a lycopodium male or female, anyone may need a pulsatilla as an acute. And Merc is in relationship with a lot of polycrests. So in acute situation, if it is a calcarea, you might need Merc. If it is a lyco, you might need Merc. I've used these remedies very often in acute practice. So you might want to try and see the result yourself. Then there is natrum patient is there, CPR patient is there. So they might need bryonia as an acute. So sometimes if the patient is giving one or two confirmatory symptoms, but rest of the things are vague, you might try bryonia because you know the remedy relationship and you have tried it before. So, you can just try this. And I remember a number of cases where natromure constitution PCOD patient is there, or some thyroid patients will need natromure a lot. सो ब्रायोनिया दे दिया उठा के ज्यादा सोचना नहीं है इजी हो जाता है हमारे लिए भी बट आई इंसिस्ट ऑन कंफर्मिंग द फिजिकल जनरल्स एंड थर्मल थर्स्ट ये सब कंफर्म करके अगर आप देंगे तो योर प्रिस्क्रिप्शन विल बी एक्यूरेट एंड द रिजल्ट्स विल बी वेरी क्विक लाइक 24 hours 48 hours so on. Coming to the next case. So this is a case of 4-year-old boy who is having asthma and he has been referred to us by a pediatrician. So he is taking inhalers, anti-allergic since months. And he came to us on 25/11, that is November 25th. So based on the modality of cough and history, we started with Causticum 200 and Aspidosperma QID. And then we reduced it to BD and then we reduced it to only night doses. So this went on for a while till one day he developed fever. So on 29/12, है ना 29 December, they told us that there was sudden fever since last night and the cough got worse. Before this, he was much better and he was coughing negligibly or sometimes no cough was there. Allopathy medicines had been stopped and he has been much better. But this fever developed. So concomitant was nausea. There was vomiting once. Then coughing will end in vomiting. They said so, but there was only one time vomiting because it was they came very quickly. And he had only milk. He was not eating that much. And during coughing, during eating he was coughing a lot. So he was not able to eat as well. So earlier we had been giving him Causticum 200 and Aspido only at nights. So I told him to give it 4 hourly QID for a few days. But since it was this suspicion of COVID and he was having a lot of nausea, I decided to give him Nux Vomica 200 as well. So I told them to keep this bottle of Nux with them and use if required. And they needed 2 doses of on that day because he was vomiting. But then again, he was better. They continued with Causticum for a while. And child was better in the next 48 hours. So this child was super allergic, and we were expecting a lot of reaction and the need for inhaler and all those things. But fortunately, okay, uh, okay. So, sometimes if you know the nearby pediatricians and physicians, they'll refer patients to you, and the pressure of giving good results is little more because they have been referred to by another doctor, especially an allopath, and then you know how it is the equation between homeopaths and allopaths. So, this is a big thing that they'll refer cases to you. It's very nice that they way. And when my other branch colleagues refer patient to me, I always give them an update about the patient. Even the patients give them feedback, and mostly it is positive most of the time. And I educate them about this thing that they can take homeopathy for any kind of fevers, throat infections, diarrheas, and all these things. Before that, you have to have a mastery, like I said before, you have to have a mastery over your acutes. So for that, I would recommend, I'm sure most of us know that there is this chart of acute remedies by late Dr. Praful Vijayakar, who, so I learned about this during I attended back in 2008, January 2008. Uh, I had just begun my practice that time. I was doing my internship as well. So that time I was exposed to Dr. Vijayakar's books and modules, and believe me, it has been such a boon. The theory of acutes, and it's been so many years now. I've been using those acute chart in my practice successfully, and I'm sure many of us are doing that. It has been so extremely useful, and I keep adding my own remedies to it sometimes, during this COVID phase, and even before that, I have all the scribblings on that chart. I've added a lot of remedies to it, and it is very useful. If you learn to use that chart, your practice will become so easy and so nice. And this is such a great thing Dr. Vijayakar gave us. This was amazing. And if you want to be a good acute prescriber, you need to use that. And then you need to add your own remedies to that, your own notes to that. You can just take it another level up as per your city, the weather, and everything. So I'll get back to the cases. So Nux was used, and then the child was better in 48 hours. Case was closed. So now I'm going to talk about some frequently indicated remedies for pediatric COVID, pediatric fever, and URTIs. Belladonna. So we all know the indications: refusing to eat, refusing to drink, head is very hot, loquacity during fever, and child is playful. If you see, the parents are saying ki child is sick, yet he wants to play. Only for a while he'll become dull, and again he'll get up and start playing. This is typical of belladonna. And throat pain may even start much later, but you see the prodromal symptoms that कल से खाना नहीं खा रहा था, अचानक से उसने बोला मुझे खाना नहीं खाना, and then the head was hot. This is belladonna. ठीक है. Then another champion remedy which is very good for viral fevers is pulsatilla. So even on the first day, or even on the fifth day, when the discharges have become thickened, yellow mucus is there, even then, if it is a pulsatilla child, then you need pulsatilla. And it is a very common remedy. Pulsatilla is acute to sulfur, calcarea, lycopodium, so many remedies. So naturally, it is used very often. The main PQRS that I find useful in practice is cough and lying aggravates. The moment they are lying, they'll cough. Yellow mucus and thirstlessness. And then the child is usually clingy. and they like all that cuddling, all the kissing and attention, and मुझे ये हो रहा है, नखरा वखरा and all that. So Palsilla. Then the third champion number three is Merxol. We have already spoken about it. If you see salivation, if you see redness, and there is a bad odor from offensiveness is there already, there might be runny nose or there might be thick mucus. Either is okay, doesn't matter. But if you see that thirst is more and saliva is more, and offensiveness sometimes may not be noticeable initially on the first day, but just ask about it. And these tubercular kids very often develop infections and they need Merxol very often. Another useful pointer on Merxol is in some literature it is given that it is preventive in pneumonia. So if the child is getting high fever, there is bacterial infection also, there is viral infection, any infection might be there. It prevents pneumonia, and I have seen that so many times that we gave Merxol quickly and there was no complication. In some of my cases, they had a history of pneumonia, and what I have seen in pediatric patients is they might get pneumonia every other year in some cases. So Merxol is good, and then there is Hipersulf. In the last 2 3 weeks, Hipersulf was not that useful, but in general, in COVID cases, Hipersulf is a useful remedy because we were seeing symptoms related to sinusitis. The weather has been very cold. Then my 4 number champion, Nux vomica. So because of that cold weather and retching, vomiting, nausea, fever, dullness, thirstless. ये 5 main indications to हैं that point you towards Nux vomica, and Nux vomica is dull, cranky, does not want to be disturbed. Don't talk to him, just let him be alone. This is Nux vomica. So Nux kids will become super cranky before they fall sick. They will be very irritable and cross. चिड़चिड़ रोना, capriciousness. So the mother will tell you कि कल से चिड़चिड़ चालू थी. This is Nux. And they might have some gastric disturbance like vomiting we mentioned, and there could be some constipation as well, or some nausea and bad taste in mouth, sometimes bitterness. Nux is like that. Champion number 4, Drosera. So Drosera is very useful if the child is lean, tubercular, very active child, prone to allergies. You might need a dose of Drosera, and sometimes you might need only 1 dose of Drosera. That's it. And you may not want to even repeat it. If they are improving, then you can maybe decide not to repeat. As per the literature, various books, Drosera should not be repeated often. And I usually give 2 or 3 doses, or sometimes even single dose. And then there was causticum. Causticum was more useful in the adult cases because causticum and even the whole Cali group was very useful in the adult cases because they all had this sinusitis, ear fullness, and all these symptoms. Kids don't have sinuses, they don't get the sinusitis, but they do get thick discharges, they do get earache sometimes, and a lot of mucus formation. Blata 30, Blata 200, and Blata tincture. These things are very useful, but Blata is the bigger weapon, and I use it only when when I feel that the patient is severely allergic and develops bronchitis very quickly, and they have a tendency for that. And dust allergy is also a good indication of Blata. So I take out Blata only in those cases. So it's a bigger weapon. Then some common remedies like China, Cinchona, Gelsemium, Eupatorium, Arsenic alb, Ipecac, Lachesis, Phosphorus. These are the common remedies used as per indications, but I will put them in the second category. Then there was Cassia sophera tincture. So tincture of Cassia sophera I use very often in cases where there is a lot of phlegm, mucus. If the phlegm is a lot, rattling, just like we see in this एंटम टार्ट and all that. Although हम लोग एंटम टार्ट की स्टेज तक पहुंचने नहीं देते, if you start the medicine quickly the patient will not reach that एंटम state, right? So Caseosperma and Aspidosperma, this is my fifth champion. Aspidosperma Q, This is used when indications are not clear and the patient is coughing a lot. It could be wet, sometimes a little breathlessness is also there. So then I use aspidospoma. So there is this chart, comparative chart that I've made. I would try to share it. I've already shared it in the study group about comparison between Blatta, Cassia, Aspido, Justicia, all these tinctures. It's very useful. Everyone should read it. Mm, it is there on my web on the blog page if you want to go through it. Then some other remedies, Ferrum Phos 200x. So this is a tip I got from my teacher, Dr. Sethia, during my MD days. So for unclear picture, fever, and possible pneumonia maybe, or some vague indications are there. But it lies somewhere in between. Sudden भी नहीं है, बहुत slow भी नहीं है. It has vague indications, but I use this biochemic trituration, ferrum 200x, in fever cases, especially when the fever has been there for more than 2 days. Natramur 6x I have used in many kids where I see allergic tendency, where there is a skin, sneezing ka tendency, salty mucus, salty taste, runny nose, egg white like whitish discharge. They're also prone to dandruff. This natromure ke indications, if they are there in the patient, even if it is a sulfur case, sometimes in acute you might need it. So 6x natromure. Bio number 6, bio combination number 6 I use in common cold cases very often where I don't want to disturb my case with anything too much potentized. I try to use this. Calimure 6x is useful and as per indications, and Justicia Q. Justicia Q I use very carefully because I have seen whatever is written in the literature, and whatever I have seen in practice are slightly different. So because of that, you have to be a little more conscious. And sometimes if you give too much of Justicia Q, then there's a lot of dryness, so patient becomes uncomfortable and they may come back complaining. So you have to be careful with the Justicia. Okay. So Dr. Sushma is saying that the upper respiratory is involved and fever is, yes, you're right. Fever, with the right remedy, you can cut down the fever to only one episode or maybe 2 episodes. And even Abhi, just now, before coming here, this last case I saw, this little boy, he's prone to getting high temperatures, and he's a typical pulsatilla boy. So I gave him pulsatilla 1M. So the fever was there for 48 hours, but it was coming down slowly, slowly. Third day, yesterday, he was fine. Today he was fine too. But they came because he was constipated and having some colic. So I had to retake the case and give him something else. But we could manage the whole episode with pulsatilla alone. It was so good that he did not even have coughing. Otherwise, cough is expected after viral. Most of the people will say कि हाँ viral के बाद थोड़ा खांसी होता है. But if your prescription is accurate and very perfect and the potency is perfect, then you don't even get these things. There might be a little bit of negligible cough or negligible complications like ear pain or something. So this comparative chart of Cassia, Justicia, Blatta, Aspido tinctures you can see on my website blog page. I would like to share it later maybe. Now we have some pointers. So like I already said, we might know the constitutional remedy, but acute state may demand a seasonal or acute RX. Okay, so when you make an acute totality, you should have some physical generals, at least one PQRS, and then or it should be complete symptom, one complete string, or maybe a very strong mental. For example, loquacity during fever or something like that. There should be some strong mental, a combination of these two or three things. Like we said, that three-legged stool should be there. So you should have three pointers at least to pick a remedy. Sometimes in pediatric cases, the child is very cranky. Parents are not able to give that history. बच्चा रो रहा है, माँ कुछ बता नहीं पा रही है. Everyone is hyper, so you may not get a clear history, but you tell them to calm down and ask specific question that you want to know. If you ask vague question, और क्या हुआ और क्या हुआ और क्या हुआ, you might not get an answer. So you have to be more specific sometimes, and you have to if you are thinking about a particular remedy, आपको खोदना पड़ता है, खोद के निकालना पड़ता है कि लेटने पर खांसी आती है, सुबह उठ के खांसी आती है, केवल दिन में खांसी आती है या केवल रात में खांसी आती है. फॉर एग्जाम्पल दैट केस ऑफ कॉस्टिकम, so we saw the cough was only in the night time. In the daytime, he was fine. This is a single remedy rubric given in the repertory. Cough at night, only at night. So if you give causticum, you will get a amazing result. Just pick the right potency. Usually, we give 200. In pediatric cases, you can give a higher potency, or maybe a water dose. It helps quickly. And don't give tinctures right away. You hold them off unless the patient is extremely allergic, then you might add a tincture. Then repetition. Yeah, some kids will need repetition, but if you see that there is a very good improvement, then you may ask them to not repeat or slow down the dose, like QID ki jagah BD, OD, and then stop. You can do that also. So there will be like maybe 6 doses will be given in 3 days, right? So you need not give QID for 5 days. Some kids don't need that much. Next, biochemic can be used. They are less potentized, they are safe, and kids respond quickly. So biochem use I usually encourage. Rest, it's up to you how you want to practice. And sometimes in very very mild cases, I have seen amazing result with something like bio number 6. Only that is given, and the patient is fine. And sometimes natromure 6x, yeah, calimure 6x, something like that. So you need not give anything much potentize, just that. But you have to tell them that you keep us informed. If there is something major, you bring the child. You should not assume that if they are giving this, then they need not see the doctor. Right? You have to keep the thing open ended. ठीक रहा तो मत लाओ, ठीक नहीं रहा तो ले आना clinic पे. That ways. Okay, give them an option of video consults, because sometimes when the child is small and very sick and parents are both working, they are not able to bring the child. Video calling को option देना चाहिए. I personally feel that. And if you want to examine the throat particularly, then you can ask them to make a video of the throat and see that. And then there is examining the chest. So if that is required, you need to call the parents at the clinic. And in during the peak of pandemic last year, so what we did was we told the patient they were not able to come for some society restrictions. So we told them to take a video of the chest area. So we could see the ribs and those muscles moving because the breathing was difficult. So on that basis, we had to prescribe. And then the physical journals were always there. So you can do that sometimes if they are not able to come and if you are treating them remotely. So keep the option open. This is how you build practice. Okay, then the next thing I have noticed, even in my study group, I have noticed that there are a lot of doctors who sadly don't know how to take a case. Acute case में क्या पूछना है, क्या consider करना है, they are not able to describe. है ना? And so I would like to share this acute case proforma. मैं ये proforma जो है वो अपने blog पे डाल रही हूँ आज ही. So you can view it there. But let me read out the pointers for you. So how did the complaint start? Sudden, or how it started, the way it started, and getting wet, or after a reprimand, after having ice cream, or something like that. So how it helps? So if the complaint started after getting wet or due to cloudy weather, you can think of remedies like Rustox or something like that. If it started after ice cream, you can consider Pulsatilla maybe, right? So you need to know how it started. You can, ask that because everyone has individual triggers, right? And climate के बारे में जानना ज़रूरी है how the climate is because some remedies are used in certain climates. For example, during this episode, since the weather was cloudy and all that, cold and cloudy, I used Rustox quite a lot in the adult cases. So fever, body ache, a little cold cough, leg pain, Rustox. Just have to confirm the physical generals. And then initial symptoms and recent symptoms, both we need to know that initially kya hua tha and what was suppressed. For example, if the cold was suppressed with a lot of anti-allergic, you might consider Naxomica, right? And the current symptoms also we need to know. Both we need to know. Then fever ka, if there is a specific time, if chills are there, heat is there, sweating is there, thirst before, during, or after fever, this is useful when the fever symptoms are more prominent. If the fever has already gone and now we are seeing the patient in a different state, then this may not be useful, but you need to ask. Cough ka time, position, and what triggers it. For example, taking a deep breath, cough verse after taking a deep breath, a deep inspiration. This is bryonia, right? Cough on opening mouth. The moment the patient starts to speak, there is coughing. You can think of Rumex. Cough only in the night time, then causticum is there. So, lot of remedies are there based on modality. So, if you find that PQRS symptom modality, you can prescribe quickly. Then discharges. The discharges will point you to a lot of remedies. For example, the Cali group always have this yellowish thick discharge. And so, okay, arsenic has profuse discharge, acrid discharge. Then associated symptom like a headache is there, body pain, chest pain, pain in remote areas. For example, last time we saw the adult patient, we saw that rib pain. Rib pain was there during inspiration or coughing. And that's why we used bryonia. And there was some concomitant symptoms like bladder pressure, involuntary urination during cough. So we have number of remedies for that. Okay. What aggravates cough or their symptoms? What ameliorates? You have to ask that. And it takes like less than 10 minutes to ask all this. But for some reason, I see that the lot of homeopaths, they are not asking these questions. Mouth, condition of mouth. If it is dry, it is salivating, it is moist, and how the tongue is, thirst, then stool and urine. Yes, color or any changes or frequency. For example, gelsemia patient will have frequent urination sometimes. They are thirstless, very dull, but still they have frequent urination at times. So you can check that. Nux may have ineffectual urge. They'll go to the toilet and come back again. So it's a good pointer. Then thermal reaction we need to do. Tongue we need to know. Tongue and even taste because we are dealing with COVID here. Mental state, if it is available, if it is prominent, you need to know. In children, you may find some peculiar symptom that the parents will observe and tell you. In adult patient, sometimes you may not find because when it comes to COVID, everyone is anxious. So you need to ask. You need to be more specific. But if you don't find anything prominent, let it be. It's okay. You prescribe on the basis of physical journals. Any other changes, history of medication that they have taken. So you need to know that as well so that you can see what stage we are on and CRP levels, D-dimer, all those things. In pediatric cases, you don't need all these usually. Even most of the people will not even do an RT-PCR. And again, it is very inaccurate. So, but still, if the fever is there for more than 3 days, or even if the third day you feel the fever is high, then go for a blood test and check the CRP and all these levels. If it is very high, then you need to consider other things, changing your prescription, even taking the help of a pediatrician if you need to. If you feel that the case is very severe, serious, then you might need help from an allopathic doctor as per the protocol, government protocol. But then you need to know these things. Neutrophil levels कैसा है, platelets कैसा है. Luckily, in pediatric practice and in this wave, we are not needing all this. And there were some more pointers: rest, isolation, fermentation with tap water, warm fluids, soft diet, no force feeding, massage, light and comfortable clothing for the patient, unconditional love and patience for the parents. I told you this before, this is very important part of managing a COVID case. क्योंकि घर में महाभारत, child will be worse. Okay, respond to queries. Just tell them that you are there for the child, and consider changing remedy if required to. Don't be embarrassed to change remedies or add remedy. It's okay. Sometimes in a desperate situation you may need more than one remedy. We cannot pretend to be classical homeopaths in that state, because sometimes if that similimum is not that perfect, then you might need another one, so you have to consider that. And again, we are not deviating from the principles, but sometimes desperate situation might require a desperate measure. That does not mean that we are going to do any kind of mixopathy, but you might need a second backup remedy sometimes, or a change of remedy sometimes. Okay, and like earlier I said, don't be afraid of examining or seeing the patient. If you are alive till now, it's been 2 years now, even if you are unvaccinated or whatever vaccine you have taken, if you are alive, then ठीक है, it's okay. Okay, homeopathy is there for you, and of course government protocol you have to follow, otherwise clinic बंद हो जाएगा. But you need to be a little confident here, है ना? अगर आपको होम्योपैथी ने 2 साल तक बचाया है तो आगे भी बचाएगी. So now are we ready for some intercurrent antimiasmatic that can be used in such cases? Okay, intercurrently. So the first case which I showed, pyrogen was used as an intercurrent. Merck was indicated. Merck 1M was given, but fever was still not coming down. There was a lot of pus in the tonsils. Even the child looked toxic. So 1 or 2 doses of pyrogen were given, and then the pyrogen was stopped. So as per the indications, you may need something, but fortunately, this particular variant now that we are dealing with, omicron, and current variant, it's very mild, so you might not even need an intercurrent. Yes, drosera. In couple of cases I used drosera single dose as an intercurrent, where I saw some slow response. Then in adult cases, I'm not talking about pediatric, in adult cases I have used tuberculinum aviare in some of the cases, where I saw some poor response. So I gave 1 dose of tuberculinum aviare and 200 or 1 m potencies, single dose. The main indication was upper lobes. This upper lobe area was affected, and they felt some weakness or some discomfort in this area. So that was the main indication, and poor response. Poor response to indicated remedy. Somebody is asking potency. I don't know which case you are referring to. Okay. Do we have any other queries? Okay, even if we have more queries, you can use DM, and then you can message me later. Yes, somebody mentioned lecasis is one of the cases. Yes, lecasis is one of the good remedies, but we have had only 1 or 2 cases who needed lecasis. Most of the time we needed the common medicines. And interesting thing about lecasis is it is used in acute and chronic both. So sometimes a lecasis person or a lecasis child might need the same remedy in acute or chronic both. Very occasionally, they may need a different remedy. Just now, last week, I had this case. This guy is a lecasis. He came to me for sleep disorder, insomnia. He's better now. He's fine. We have stopped the treatment as well. But he developed some body ache and possibly fever and some cold and all and vague symptoms. Probably it was viral. So the thirst matched bryonia. So I gave him bryonia that time. So bryonia is another champion remedy, but in kids I have hardly used it. Kids hardly need bryonia. Belladonna, yes, belladonna is amazing remedy. Um, so if you see the rubric under the section of fever, viral eruptive fever, viral eruptive fever is one category. So that covers a lot of viral fevers actually, because in many virals you see the rashes coming. So it's not just chicken pox or measles and all, but in very viruses we see, even COVID we see sometimes the rash comes. So Merck, Pulse, Belladonna. These are the top remedies given in that rubric. And if you know go through these rubrics, you'll find such amazing gems. Anyway, do we have any more questions? Okay, I think we don't have many questions now. I would like to end this session in that case. I hope you learn some useful things and you are able to use them in your practice, apply them in your practice. And the next session we'll be doing with screen sharing, of course. That will be on thyroid cases, hypothyroidism. We'll show you cured cases with the 2 or 3 year follow-up. Absolutely cured cases. So with that, I'll conclude the session. Thank you very much for joining. Which potency of belladonna is used? Okay, I usually go with, if I see a high temperature, 102, 103, I go with 1 m potency. And was unavailable, we have used 200 as well. But 1 m is my best prescription, I feel, because it, but you cannot give it in every case. You have to see that it matches. Hmm? You cannot just give belladonna to every patient, but usually psoriatic and tubercular kids, psoriatic and tubercular kids, you will see that they'll, need belladonna and then they'll, respond quickly. PCOD. Okay, PCOD. Yes, we'll go with PCOD. Oh my God, PCOD is so vast. But yes, we'll what we'll do is we'll take infertility and PCOD. That will be better. Hmm? Fibroids. Okay, we'll try to do that. Fibroids, endometriosis, and such things. Fibroids are difficult. Anyway, so I'll conclude the session and thanks for joining everyone.